2-minute response.
A lot of this goes back to the question of rights. And I know that socialists believe that healthcare is a right, is a fundamental human right, and I do not. I do not believe it's a right. Rights are rights to action. It's the freedom to act. It doesn't mean that someone else gets to take care of you or gets to pay for your medical bills or that you get cheap medicine. It's not, simply put, healthcare is not a right, which then informs which path you're going to take. Something about the government making plans more expensive. Right, costs have been going up for a long time, but as I said, one reason why is because you've got different industries. So you have the podiatry industry, you'll have the diabetes industry, and so on, the maternity industry. They will lobby Congress to, or your state legislature more often, they will lobby them to say, you should really make it illegal to not include our service in your comprehensive health insurance. And so a friend of mine, for instance, a good friend of hers that I met, she had a hysterectomy. And so she called her insurance company and she said, can I take out the maternity care from, I don't want to pay for it anymore because I had a hysterectomy, I shouldn't have to pay for that anymore. And they said, well, in Washington State, it's illegal for us to offer a plan that doesn't have maternity care in it. So she has to pay for something she's never going to use because the legislators decided to pay back the special interests and say, your insurance, hey, group health, your insurance coverage must have this in it. So it's all these various mandates that increase the cost. As a young person, like I said, I just want a catastrophic plan. That's all I need. In case I get hit by a car or I get cancer or something like that, I want a catastrophic plan that costs $20 a month and an HSA from all my regular little day-to-day problems that I have. The report, oh, my time's up. Okay, thanks.
2-minute response.
I just think it just doesn't. That would be nice if we could spend $20 a month and have a catastrophic insurance plan, but that's very rare. Most insurance plans are very expensive, and I've never really heard of an insurance plan that costs $20 a month. I think that's highly unusual. I'd like someone to show me that exists. They're usually much more expensive than that. And the thing is that we live in a society. Like, why should everyone have their own individual little healthcare plan? Why not? We're one community. We're all going to get sick one day. We're all going to have accidents at some point in time. It makes sense to have a planned out system that covers everyone. We're the richest country in the world, yet we have 47 million people that have health insurance. It's proven. I could understand if it somehow was a negative thing to have government provided health care for everyone, but it's proven by the United Nations, not by some radical socialist organization. The United Nations. The United Nations, their World Health Organization, they did this survey, and it's proven to work better by every single measure. So you can have this theory that the market system will somehow work better for individual liberty, but I do think it takes away people's freedoms. If they can't get health coverage when they're sick, if they can't afford to go to the doctor, how free are they? How free are you if you're poor and you can't access these resources? We as a society should recognize, hey, everyone's going to get sick, everyone's going to have an accident at some point in time. It's simpler, more efficient just to have one agency that provides the health care for everyone. Now, I do think one thing is I would say that the so-called socialist countries like Canada and Europe, those are still capitalist countries. They may have socialized medicine. They may have publicly owned healthcare, publicly run healthcare, but it's still a corporate-dominated government, corporate-backed governments. And so they, just like our corporate-backed government, they don't fully fund healthcare, just like we don't fund our public schools enough. And so there are problems with those systems. And what we would advocate is full funding and also democratic control over the healthcare system by the nurses, by the doctors, the healthcare professionals, and the patients having more of a say.
Yeah.